Hello and welcome to The Truth About Tooth Decay, a podcast brought to you by the Oral Health Foundation. This is a 4-part mini-series where we're going to be talking about tooth decay, what causes it, how to avoid it, and what to do if you think you're already showing signs of it. So my name is Sophie, I'm from the Oral Health Foundation, and I am joined by Karen, one of the Oral Health Foundation's dental advisors and dental helpline members. A very quick safety reminder that we are following all of the coronavirus restrictions that are in place at the time of recording, meaning that all of the guests have been recorded remotely, safe at home. This series is also proudly supported by Colgate. Now, Karen, when I look back and think about when I was little and I was taught you need to brush your teeth, have to brush your teeth, go brush your teeth, and I do, don't get me wrong, but when I look back, I notice that I wasn't really ever told why it's important, why we have to do it, why you should do it a certain way. And I think that's quite strange, but I don't think I'm necessarily alone in that. What do you think?
No, I mean, I don't think you are alone in it. Obviously, it is part of our personal hygiene routine. And we almost know why we wash our hands, we wash our face, because we can see the dirt on them. Whereas we don't necessarily see anything that's on our teeth. But all the time, you know, day and night, plaque is building up on our teeth. And plaque is the sticky film that you can feel on your teeth. And that's being produced, as I say, all day, all night. And it is important to remove that, because when the plaque reacts with the sugars in our diet, that's when it produces plaque acids, and that's when dental decay can occur.
So what actually happens to our teeth when we start to develop this plaque and dental decay?
Well, the plaque, as I say, when it has a chemical reaction with sugars, and the acids then start to attack the enamel of the teeth. Now, over a period of time, that enamel will be eaten away and it will cause a hole. So that's when the decay will get into the tooth, and it will, if it's not treated, it will progress right into the tooth and into the pulp chamber and effectively kill the nerve of the tooth. So you're looking at quite extensive treatment if you get to that stage. So it's really important that we clean the plaque off our teeth every day, and we visit the dentist regularly so that they can check for anything that might be going on there, because if it's caught early, it's much easier to treat.
So when you say caught early, what are some of the early signs that you might be starting to develop plaque or getting a plaque build up on your teeth?
Well, early signs you won't necessarily know yourself, which is why it's important to go to the dentist. When you get to the point where your tooth is sensitive to hot or cold or sweet things, it means that decay has progressed through the enamel of the tooth and it's now into the dentine, which has nerve endings in it. So that's why you're getting that reaction. So when it's got to there, that's normally when it sends people to the dentist. But yeah, plaque, when it's left, will form scale or calculus on the teeth. So if you notice that you've got sort of deposits on the teeth that you now cannot remove, that is hardened plaque that, you know, hasn't been effectively removed in the toothbrushing regime.
Okay, and when you say dentine, just because I'm not medically trained, what exactly is dentine?
Well, when you look at the layers of the tooth, so if you've ever seen the model of a tooth, you know, the cross section, it'll have the enamel on the outside, which is the thickest layer, and the enamel is the hardest substance in the body. However, it doesn't withstand everything forever. You know, there's a certain amount of beating it can take before it actually starts to decay. Now, that doesn't have nerve endings in it, so it isn't painful. So that's why we can eat and chew and we don't get any symptoms from that. However, the next layer underneath is dentine, and dentine does have nerve endings in it. So if the decay has gone through the enamel into the dentine, you will start to get sensitivity symptoms, because that the nerve endings are reacting to the hot and cold sensations.
Okay, so say for example I decided that I have gone on a toothbrush strike. Terrible advice, please always brush your teeth, but say, for example, I did that, how soon are we talking? Am I going to start developing these symptoms and this sensitivity? Is it going to be over a really long period of time, or are we talking days here?
It depends. I mean, I wouldn't have said it was days, but there are dependents. Obviously, it depends on your diet. It depends on the strength of your enamel, and it depends on, whether there is fluoride in the water, whether you're doing other things. If you're not brushing your teeth, are you rinsing your mouth with something that might help? But obviously, nothing will replace the mechanical brushing and removing of that plaque from your teeth. Dental decay is completely preventable with a good oral hygiene routine, which we'll talk about later.
I'm just looking back and thinking how little I really ever knew about the importance of cleaning your teeth and what tooth decay actually was. I genuinely thought that tooth decay was just when your teeth turn a bit of a funny colour and you get yellow patches, and that's to me, that's all that tooth decay was, but it's actually a lot more than that.
I mean, it can do. I mean, there will be, if the decay isn't really small, yes, it will produce black holes, you will see that, but that's quite extensive, which we would hope if somebody's going to the dentist, it's going to be picked up earlier. But it doesn't mean to say that if you see something in your mouth that has not been there all the time, so if you see a new mark on your tooth, then it's as well to go to the dentist and get it checked out. And equally, if you haven't been to the dentist for a long time, it's not a problem. I mean, you shouldn't be embarrassed about going, even if it has been a little while, because not all black marks on your teeth are necessarily decay. It could be staining, it could be other things. So you shouldn't be too worried about making that change, because it's never too late to get the treatment.
No, you are right. It can absolutely be a bit of a sensitive topic with some people, dentists and dental phobias. And we all sometimes think, okay, I'm not doing everything that I should be. I skip my nighttime brush sometimes, or I forget to floss. We've all had these thoughts at some point, but it's just so easy to fall into those habits of skipping brushing, and then maybe feeling a little bit embarrassed about when you go to the dentist and you haven't been doing as much as you could do. But you are absolutely right. It is just about getting these routines right, isn't it?
It's about learning these habits early. So the sooner we start to teach our children about it being part of the process of, like I said before, part of our personal hygiene, and giving them a reason why, and starting dental visits early. The recommendation is that children should have their checkup by their first birthday. So it is important to get into this habit, and these habits are then set in place for life. And dental decay is completely preventable. So we just need to be aware of what causes it and how we prevent it. So looking at, we've discussed how dental decay is caused, and we know that cleaning will help to prevent it, and having a good diet will help to prevent the plaque acids doing the damage to the teeth. So bearing all those in mind, and using our dentist as the first port of call when we're either worried about it or on your general checkup, that will be a great start to trying to keep your teeth as healthy as possible.
Yeah, so we've talked about sensitivity and what causes the sensitivity when the bacteria gets beneath the enamel, which is the outer layer, and gets into that dentine, which is all the nerves of the tooth, and then that's what's causing the sensitive reaction. But if it's sensitivity to be concerned about, how long is that going to stick around for before it's starting to indicate that it might be something a little bit worrying? Because, I can have a sensitive tooth sometimes, but then it goes away after a little while, where I'd imagine if it's something a little bit more concerning, or it is a sign potentially of tooth decay, it's going to be around a little bit longer than a few days. How long are we talking?
I would say initially, because obviously when we're talking about sensitivity can be caused by other things other than dental decay. So if we have a little bit of gum recession, which majority of us over our lifetime, our gums do recede a little bit. So normally we probably start with using a desensitizing toothpaste. So if that problem hasn't gone away in a couple of weeks, I would be saying go and visit your dentist, just let them have a look at that area. Generally using a desensitizing toothpaste, that will help to alleviate the problem within a couple of weeks.
Right, so say for example you don't catch it early and the tooth decay is just left to develop, what's going to happen then?
If the tooth decay goes through the enamel into the pulp chamber of the tooth, so the next layer underneath the dentine, as we talked about, the enamel, the dentine, then you've got the pulp. Now the pulp chamber is where the nerves of the tooth are, so they go down into the root of the tooth. Now if the decay goes right into the tooth, the nerve inside the tooth will die. Now that can cause an infection or an abscess. So at that point, the tooth will either need to be root filled, if that's possible. So that's a procedure where they clean out all the dead nerve tissue from within that root system of the tooth, disinfect it and seal it, and that will eradicate the cause of the infection. But if that's not possible, then unfortunately that could lead to having to have the tooth removed. So it is quite important that we catch things early before they get to that stage, and then we can keep our teeth for as long as possible.
Okay, Karen, I think that's a fantastic place to leave things today. We have discussed an awful lot. We have discussed tooth decay, what that actually is, what those early signs of tooth decay might be so that you're aware of those early warning signs, the importance of regular checkups with the dentist, and how to form healthy brushing habits to keep tooth decay at bay or just make sure it never gets off its starting blocks in the first place. Next week, we're going to come back and talk about tooth decay in a little bit more detail, and also talk about how it can affect other areas of your health, like your mental health and physical health, not just your oral health. So should be a really good episode. Thank you, Karen, again for joining me today. If you want any information or advice in the meantime, our website is www.dentalhealth.org, and you can find us on social media at dentalhealth.org as well. Okay, lovely to see you, and we will be back shortly.
Fabulous.